series that Community Solutions and Advocates for Ohio's Future have been co-hosting over the last several weeks and will be for the several weeks to come, and looking at the impact of COVID-19 and overall the pandemic and economic issues that have resulted, and kind of looking at them with the intersection of a lot of different health and human service issues. And today we're going to have Emily Campbell, who is the Associate Director at the Center for Community Solutions, talk to us about the results from a survey that Community Solutions put out into the field a few weeks ago to really understand the impact of COVID-19 on a variety of nonprofits, local government, the philanthropic sector, just to really understand and get a deeper understanding of how operations have changed, how their staff and their clients have been impacted. And we know that many of you joining the call today likely responded to that survey, so we thank you. And this is a good opportunity to kind of understand where you fit into all of that. So with that, I am going to turn it over to Kelsey Bergfeld with Advocates for Ohio's Future to do a little bit of intro and talk a little bit about our series. Thank you.
Thanks so much, Tara, and good afternoon, everyone. Thanks again for joining us. My name is Kelsey Bergfeld. I lead Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of advocacy, policy, and provider health and human service organizations from across the state. We are very excited to be able to provide this webinar each week. And again, as Tara said, we are actually scheduled all the way through June, looking to go into July with more and more topics and subjects to make sure we have an opportunity to learn from those experts and make sure that we can also provide an opportunity to ask questions, because we know that there's a lot of experiences and doubt and uncertainty during this time, and we want to get you the best information we can. So I will go ahead and hand it over to you, Emily. Please kick us off whenever you're ready.
Great, thank you, and good afternoon, everyone. Thank you for joining us. Flipping through the list of attendees, I see a lot of familiar names, so I'm happy to meet with you virtually here this afternoon. So as Kelsey and Tara mentioned, I'm Emily Campbell. I'm the Associate Director and Williamson Family Fellow for Applied Research at the Center for Community Solutions. And I'm really excited to be here today with you all to share some of the results from the survey that we conducted over the course of 2 weeks, a couple weeks ago, looking at the impact that COVID-19 and the stay-at-home order is having on service providers. So we are hearing a lot of anecdotal information about the impact of COVID-19 and the stay-at-home order. And I'm mentioning those two things as a group because what we saw through our survey is that the virus itself certainly has impacts, but it's also the government response to that virus that is really changing the way that services are being delivered right now, as you all know, I'm sure. What we wanted to do was really move from that anecdote and collect some good data, some data that we could have a sense of whether or not what we were hearing from individual groups might be best case scenarios, worst case scenarios, or what the scope of some of these issues might be. We also wanted to get a sense for if things looked different for large groups versus small groups, for those in different parts of direct service provision and other parts of the nonprofit community and those who are working in health and social services. We know that there are tons of surveys out there right now. There are daily poll results coming out from a couple of different sources. Earlier this week, a survey from the Ohio Attorney General, Philanthropy Ohio, and the Ohio State University was released that looked at across all registered nonprofits. The Federal Reserve Bank of Cleveland is also surveying agencies. So, you know, we think that all of these are very important sources of information about what is this particular moment in time and the snapshot of what's happening right now. We think they're all valuable, so thank you for completing our survey, and those of you who've completed other surveys too. One of the ideas that we're toying with is perhaps almost a lit review of all the surveys that are out there to see what might be different and what might be the same. But today I'm going to focus exclusively on the results from Community Solutions survey. As we go through some of the slides, some of this might be a little bit little on your screen, small on your screen, but we are planning to share the slides afterwards so that you can, of course, go back and take a look at it. And we already have a report on some of this information that is posted on our website, communitysolutions.com, and more will be coming out, being released over the course of the next couple of weeks. So this is also an opportunity for us to dig a little bit deeper and look at some of the things that aren't contained in those reports and look at things a little bit differently. And although it's being mentioned, if you have any questions, please do answer them in the chat box. I'll maybe take a glance at it as we go through, but be sure to try and leave enough time for us to go through those at the end. Over the course of 2 weeks, from April 14th to April 26th, and those dates are important, 734 people responded to our survey. They came from organizations large and small, representing a wide range of nonprofits and others. It included direct service providers, associations, and policy organizations, also a good handful of local government agencies, philanthropic funders, and of course, faith-based groups. As you can see from this slide, which is a little bit messy, but it does give you a snapshot of who responded to the survey, almost a profile of the respondents. Many of the respondents are in leadership positions within organizations, the most common being in an executive director, president, or CEO role, followed by program managers and supervisors. But we did get a nice chunk of people that identified themselves as direct service workers, either case managers, frontline workers, those kinds of things, or healthcare providers working directly with patients. Looking at the pie chart that you see in the middle, you may notice that 2/3 of our respondents represented direct service provider agencies. This included 191 who identified themselves as social service providers, 84 from the health field, and 50 from other types of direct service providers. We were so pleased to get responses from groups whose service area cover all 88 counties of Ohio, as well as some statewide groups. Our responses are concentrated in Northeast Ohio and even more concentrated in Cuyahoga County, just because that's where our reach is in some ways the deepest. But we have at least a handful from each of Ohio's 88 counties. And this was really important to us to cover the whole state. And we did some targeted outreach to ensure that we had good geographic coverage, because we didn't want it to represent only one part of the state. We want to make sure that we're including all Ohioans and services that are available to all Ohioans in our analysis. So while we're planning to do some breakdowns eventually about different parts of the state, maybe the large urban communities, maybe rural, maybe looking at different regions, that work has barely begun. So unfortunately today, I won't be able to answer questions about the geographic spread or differences between geographies. But we're going to continue to work on that, so hopefully there will be more in the next few weeks. It should come as a surprise to no one that more than 90% of respondents said that COVID-19 and or the stay-at-home order were causing disruptions for their agencies. More than half responded that that disruption has been significant. In addition to some of these closed multiple choice questions, we also had a number of open-ended questions in this survey. And one of the things we asked about was policy responses that are constraining their agency's ability to provide services. Most identified that the stay-at-home order and social distancing requirements are the thing that's causing the most disruption, although many said that they understood the need for those actions by government. Many also mentioned specific challenges presented by social distancing, including the loss of volunteers, the inability to hold events, the inability to reach clients who don't have reliable internet access or devices, and the inability to access proper personal protective equipment or PPE for staff and clients. Some expressed challenges in adjusting to working from home, and a lot of concern, as we'll see in more detail in a moment, about how social distancing and some of these issues are impacting the mental health and well-being of both staff and their clients. There seemed to be particular concern around continuing to effectively serve older adults and people with developmental disabilities and people that are facing behavioral health challenges. We are most concerned about the group that you see here outlined in red, the 1 in 5 who expect the return to services to be difficult. We looked at just those responses, thinking that perhaps there was something in common to them. And we found that the group that expects the return to services to be difficult were slightly more likely to be working in the social services field, but only slightly. They were slightly more likely to have somewhere between 50 and 250 employees, so sort of medium-sized agencies, but again, it was only slightly. And actually, executive directors or leaders were more likely to say that they expect the return to services to be difficult. As I mentioned, we had a number of open-ended questions, and here is a very small selection of verbatim comments from the survey respondents with emphasis that we've added. This is when we asked people to describe how COVID-19 and the stay-at-home order were impacting services in their own words. And this one question is such a robust source of information. Recognizing that some of you are on the phone and others of you may not be able to read this on the screen, I'm going to read them for you now. Our services are now being provided remotely. Our funders have been amazingly flexible in allowing us to adjust to virtual or remote service delivery. But as a social service agency focused on a model of relationship building within our communities, it is difficult to eliminate the face-to-face interaction. We heard this a lot from people about the challenges of eliminating that face-to-face or personal interaction. Another person said, our office is closed to the public and services are being done via telephone contact with staggered staffing and staff working from home when possible. It has been quite an adjustment. Another respondent said, due to the stay-at-home order, seniors have canceled in-home services due to fear and are afraid to go out. And finally, everyone is working from home. A lot of our emergency services have ramped up, so we've been serving more people that way. And although these are just 4 of the hundreds of comments that we received, they really give you an indication and are some of the best summaries of what we heard from a number of other groups. There was a lot of concern about the disruption of services for clients when they went remote, both because of canceling services, a lack of technology, or the inability for people to effectively use that technology. Canceled services seem mostly to be related to the legal, mental health, and behavioral health services, as well as medical services, because as we know, during this time, we had a restriction on the kind of medical services that would be available to people. Several respondents shared that their elderly clients or those with mental or behavioral health conditions in particular were unable to navigate using the technologies. Many respondents said that they had to stop taking new clients, and others also shared concern for having to stop services for programs that are often needed by vulnerable populations. Another area of concern was the cancellation of events and fundraising events and a decrease in donations and pledges. And we heard over and over and over again about the lack of access to personal protective equipment and masks and social distancing measures. Also a lot about changes that are happening, as we all know, in food and emergency supply distribution. So, we also asked some specific questions about how services may have changed. And as we expected, the most common way that respondents have adjusted to services is to utilize technology rather than working with clients in person. I was interested to see that telephone was actually more common than a change to video services. And again, in open-ended responses, many expressed concern about being able to reach only some of their clients, and about the computer literacy of their clients and ability to utilize those technologies. Service providers are very worried that some Ohioans are being left behind. Interestingly, the percentages shown here were almost exactly the same for small agencies or those that have less than 50 employees. On the other hand, large organizations with more than 500 employees were even more likely to be relying on technology. 78% of those large agencies were using video chat services compared to 65% of the overall pool. They were also more likely than the overall pool to provide limited services within their facilities, and they were slightly more likely to be limiting services. I think some of these answers are influenced by the fact that large health systems or hospital systems are included in this kind of largest group. So you see highlighted in red two things that we wanted to point out. The first is that about 1/3 have said that they are limiting services. This is 1/3 of the overall pool of responses. And 5% said they are closed completely with no services being delivered at all. So this is one of my favorite charts. It's much easier to read in the report that is on our website, so I'd encourage you to check it out. But the way that you read it is that we have the categories running down in the rows, and across, the red indicates the percent that have said that they are experiencing or expect to experience an increase in those things. The blue are those that are experiencing or expect to experience a decrease, and the dark gray in the middle are those that report that there hasn't been a change. More than half of respondents have experienced an increase in demand for services or they expect to. Nearly half have experienced an increase in expenses or they expect to. And in other open-ended questions, again, this issue of personal protective equipment came up repeatedly, that PPE is suddenly required and that the cost for that has become much more expensive. More than half of respondents said that their ability to provide services has already decreased or they expect it to decrease, and 45% pointed to decreases in volunteer availability. I want to point your attention to the middle of the chart, the 5th and 6th line down, where you see funding, both government and philanthropic. For both of these categories, about the same number of people said that they were experiencing or expect an increase or a decrease. But when asked in open-ended questions about government policies that may be constraining an agency's ability to provide services, a common concern had to do with funding. Many organizations are unsure about their funding going forward, or they're facing restrictions or funding requirements or reporting requirements that is inhibiting their ability to shift service delivery during this time. Many of these respondents mentioned specific agencies or funders that they are struggling with. And specifically groups that rely on physical locations and kind of daily head counts for some of their funding are particularly concerned about being able to maintain the same level of funding and services going forward. Some respondents listed specific federal and state government funding that might help. One area that came up a lot was for more funding to be allocated to local governments and local agencies. And so a lot more to come as we continue working through all of the responses. I know that many of you in the audience today may be particularly interested in the policies that could help or are hurting. And of course, being a public policy think tank, we asked those questions. We got a lot of responses ranging from very general to very, very, very specific. And actually we have 22 pages worth of responses that we are wading through. Frankly, the pace of things, the way things are happening and moving so quickly in the policy sphere, we're not sure that everything will even be relevant 2 weeks from now or if they're even relevant right now. But Community Solutions is using those responses to inform our own advocacy efforts, and we're sharing them with policymakers as well. And some of the things have already changed or are already being influenced. Okay, so thinking about what may be available to service providers. So the further left that something is slid, the more of an issue or shortage it is for groups. We took out the not applicable responses, so this is only among groups who needed these things. At the very top, you see personal protective equipment. I cannot emphasize this enough. PPE is a problem, a serious and urgent problem for service providers right now. It is in short supply, even for those who are deemed to be essential services. Fewer than 10% of those who indicated a need for medical grade PPE said that their staff and volunteers have it, and even homemade cloth masks seem to be in short supply. Now, keep in mind that this survey, these responses came in just before the governor announced the requirement that all employees, even in general office settings, wear masks. And so we wonder what these results would look like if we asked this question today. We know that the need for supplies has become even more urgent as things really begin to open up so that agencies can maintain services and follow the recommendations of public health experts. On the other hand, most of these places are doing a good job of providing the workplace policies that are considered important to maintain the health of employees. You know, things like paid sick leave, mental health counseling available through employee assistance programs, and of course, the ability to work from home. We ask people to tell us how concerned they are about 11 different categories. And if you follow Community Solutions on social media, you've probably seen this chart over the course of this week. One thing that we noticed right away is that people were more than 2 times as likely to say they're concerned about the well-being or mental health of their clients than their own mental health and well-being. Direct service workers like case managers and frontline workers were the most likely to be concerned about their own personal health and well-being, which makes sense because by definition, they're on the front lines. They are the ones that are much more likely to be exposed to the virus. And overall, respondents were more than 4 times more likely to be concerned about the economy in general than their own job security. Several other surveys have asked questions about worries or concerns, and so I would really encourage you to take a look at that, especially the survey results that were released this week by Philanthropy Ohio, the Ohio Attorney General, and the Ohio State University. They have some great data about this particular point. And so I want to end with a little bit of good news before we turn it over to questions. Most respondents said that they are getting the information that they need in order to adjust their work during this time. So 4 out of 5 actually said that they sometimes or always are receiving relevant policy updates to be able to adjust their services. We also asked who or where do you turn for information about COVID-19 and how to adjust your services, and you can see some of the most common categories of responses listed here on the right. 2/3 of those who answered this question cited the state of Ohio and or the Ohio Department of Health. Many noted that they watched the daily news conferences by Governor DeWine, Dr. Amy Acton, and Lieutenant Governor Husted. 1 in 5 respondents listed the CDC. Fewer relied on information from their employer, and news media of various kinds were mentioned. They were very rarely the primary source of information or the only source of information that people were listing as places where they were getting their information. So this suggests to us that people are looking for the facts directly from the source. So they're looking for those government sources. We also, which may not be a surprise, heard much more that it is the state sources of information that they're turning to rather than some of the federal sources for information. You know, they are more likely to be turning to the Ohio Department of Health than they are even to the CDC. And I think that that's great because it's information that's most relevant for service providers here within Ohio. So before I conclude and turn to some of the questions, I just want to give an official shout out to my colleagues at the Center for Community Solutions who in just the course of 2 or 3 days read through and analyzed more than 3,000 responses to these open-ended questions so that we could turn things around really quickly and get the information out as quickly as possible. So with that, I am happy to answer any questions, and I see that there are a couple of questions coming in. So Danny, I don't know if you want to read through those for me or?
Yeah, absolutely. I'm Danny, I'm the Director of Communications. So Emily, we did have quite a few questions come in, and feel free to type them in the question and answer section or in the chat box, and we will make sure Emily answers as many of them as she can. First question, residents of the state seem to be positive about the things that Governor DeWine is doing and mandating, not so much the legislators. Can you discuss this disconnect?
Yeah, this week has been really interesting, hasn't it? As the legislature has come back. I think I'm actually going to punt that one to my colleagues who are on the call, either Terry or Kelsey, want to comment on that. If you do, you're muted.
Yes, sure. Sorry, I had to get unmuted and turn the video back on. Yeah, I mean, I think that is a really, it's been really interesting for us to keep an eye on this week, and ensuring public health and public safety is ultimately the most important, and figuring out how to balance that with the economic impact of all of this has been really challenging. So I don't know that I necessarily have a good answer with how to deal with it, other than everything that we are continually doing at the Center for Community Solutions and Advocates for Ohio's Future is entirely based on the science and the data that is coming, pretty regularly, and we're getting more data out of state agencies and understanding what's going on more than we ever have before. And so I think that is, we use all of that to ensure that we're making sound policy recommendations, but there really are no simple answers. And I think the other thing I would just add there is, as the governor continually tells us, this is a marathon, not a sprint. Nothing is going to happen quickly. It's really the same thing as it relates to policy responses to all of this. And so as we learn more, as we get to new phases, we're just going to have to really make sure we understand the overall impact on public health, and try to balance that out with the needs of the people of Ohio. And we were just talking earlier today about how we're planning to conclude this webinar series when we get there sometime over the summer, with kind of, okay, where do we go from here? We've learned about the impact on these various the health and human service agencies and programs, and kind of where do we go from here to ensure that we're continuing to support the health, safety, and economic well-being of people going forward. I don't know what else you have to add to that, Kelsey.
Sure, just a brief insight. We, and as we've seen the past week with the legislature in session, it is ultimately the responsibility of our elected officials to represent the best interest of those that elected them. I mean, we can agree that certain parts of the states, different counties have had a different experience with COVID-19. Maybe those rates of infection aren't as high. And, it is up to our elected official to advocate for those counties and to do what they feel is best. So again, we give it up to our governor for having to keep the entire state in mind, but just the actions of some of our legislatures can be in some part attributed to, again, looking out for the people they represent.
Great. And some of these questions do seem to be more policy related, so you guys might want to just stay unmuted and video on. This next one does seem to be more focused on the survey itself, though. A questioner says, my experience has shown that younger people are more concerned, those under age 60, than older people. Did your results support an age difference?
We did not ask about age of the respondents, so unfortunately our survey doesn't say anything about that. I think probably to look for some of the age differences, that taking a look at some of the polling that has been done would be a great place to look. And I know further down in the questions or in the chat, someone had asked about posting links to some of the other things that I've mentioned, and we can pull some up and share them probably after the webinar. I'll give a 2-for-1 answer, Danny.
Excellent. All right, let's ask another question. Wondering if there are any additional thoughts about the cuts to Medicaid with regard to continuing to provide services and agencies potentially needing to provide more services, in addition to having many newly uninsured people in Ohio due to job loss. So if anyone in the group has any thoughts on that.
Yeah, so I can start. We know that the current or the cuts announced to Medicaid for the last 2 months of the fiscal year will not impact service or eligibility. So those were cuts made on kind of more the administrative insurance managed care organization side of Medicaid. We know that anyone who thinks they may be eligible or has recently lost insurance coverage should be applying to Medicaid and or the marketplace to ensure that they can access coverage. What we don't know yet, and I don't know that anyone really knows this answer, is what we're facing into next year. And certainly there will be more hard budget discussions to have. What we have been working toward at Community Solutions and with our partners at Advocates for Ohio's Future is ensuring that our representatives in Congress know how important it is to ensure there is adequate support for Medicaid, so that we're asking for an increased percentage from the federal government. So the federal government would cover a higher percentage of the Medicaid cost than they do now. This is something that is pretty typical during economic crises. This happened during the Great Recession. This is something that isn't just important to Medicaid, it's important to the overall state budget. And so knowing that we can keep working toward that support, increased support from the federal government, is really important right now. We do know, there will be increased enrollment in Medicaid. We're already seeing an uptick, a pretty substantial uptick in applications for Medicaid, as well as other public assistance programs, so food stamps and things like that. So we know that we'll need to continue to push for additional support from the federal government.
Thanks, Tara.
This next one is for Emily. Other than phone and virtual services, were there any other new strategies that you found organizations are taking at this uncertain time?
Yep. There were a lot of different strategies listed. Lots of things, especially about like touchless delivery of emergency food or emergency supplies, just trying to connect in different ways with clients and being creative and doing different kinds of things. So yeah, there were a number of different strategies that people are employing, but I think more than kind of the listing of what people may be doing, there was this general sense of concern and a general sense of challenge of having to connect with the people they serve in new ways and being concerned about the effectiveness of being able to do that. And so I will say from the research team at Community Solutions, this idea of remote services versus in-person services for certain things is something that we're starting to take a look at. And hopefully in the next couple of weeks, we'll have some information out about what the research before all this happened kind of said about that. But yeah, there were a number of different strategies that places are employing. I've got to be honest, when I read through them, there wasn't really anything that struck me as exceedingly novel that I hadn't heard before. I mean, I think we've heard a lot in the media, social media, from groups about the amazing innovation that has happened over the course of the last month or two as people try to figure this all out and work on it. And those were all echoed in the survey responses as well.
Great. Next question might be for the group. One commenter says in particular that they're concerned about the long-term financial health of mental health and related community agencies who provide case management, who may not be able to survive additional decreases in funding. Emily, not sure if you heard anything about this in the survey. Kelsey and Tara, not sure if you might also have anything to add.
Yeah, well, one thing I'll say about the survey results in particular is that something that struck me is that people really responded about like right now. It wasn't yet really a situation where agencies seem to be ready to speculate about what may happen over the course of the next several months, or certainly in the next state budget process. You know, I honestly expected to see many more groups concerned about funding than indicated their concern. And I think it was people were answering in the mind frame of right now, what has happened. But I think that is something that we're going to have to look at and be hearing more about. And we are anticipating doing similar surveys over the next couple of months, a couple of times. And those are things that I think we need to ask specifically about, you know, what do you all see in your crystal ball in the next version of these surveys?
And this is a quick opportunity. We will be, in terms of scheduling down the road, we will be talking to some Advocates for Ohio's Futures members who represent, and provider organizations represent these agencies concerning behavioral health, and also individuals with developmental disabilities on May 29th. So mark your calendars. We can hear lots more from them.
Sneak peek. Another question, and again, Emily, not sure if you heard this at all in the survey results. Tara and Kelsey, if you guys want to weigh in, is there any concern that funding for nonprofits will be impacted due to funding demands due to the upcoming election? This person says people will be inundated with requests for donations, and there's only so much money to go around to fight the good fight.
Yeah, you know, nothing really came up specifically about that survey, but I think we're all anticipating, you know, I think that I can speak for myself personally. I'm getting something in my email box almost every day from a different organization or several of them looking for money and donations. So yeah, I mean, we know that there is always a limited amount of philanthropic dollars or charitable donations from individuals to go around. One of the things, and this is me speaking personally, not from anything that the data indicates, but the arts is an area that has really been hurt by people not being able to go to museums, to attend in-person things. And I think there's going to be a huge push for funding to keep those kinds of agencies afloat that, you know, maybe money that isn't going to human services or vice versa. So balancing all those things is going to be a real challenge. Yeah, lots of places are going to be hurting, and figuring out how to address all that is going to be a challenge over the next who knows how long.
And I did see just in the questions and discussion, there was, seems important to bring up the work that the General Assembly is doing right now to sort of get the federal funding and federal support that's coming, has been coming over the last few months to respond to the pandemic and economic crisis. So the State General Assembly will need to do work to allocate that money throughout the state. There is an initial bill, Senate Bill 310, that was passed by the Ohio Senate earlier this week. That will move over to the House next, so we'll see what the next stages there are. But what we do know about those funds are that there's actually a total of $1.2 billion that have come to the state, or remaining, that have come to the state that have not been allocated in any bill yet, because we're waiting for the federal government to see if they can allow some more flexibility on how those funds can be spent. So that is one thing I wanted to mention. I think I also saw a question around how long does the current increased Medicaid support from the federal government last, and the current increase in one of the earlier bills that has been pieces of legislation that's been approved at the federal level does offer some level of increased support for Medicaid, which is really important. Just to clarify, we're asking for an additional increase in that percentage that the federal government would support. The current rate, increased rate, expires with the lifting of a public health emergency. It extends a little bit beyond that, but it is tied to that lifting of the public health emergency. When this additional increase that we're asking for right now to be included in the next round of federal support wouldn't be lifted until the recovery, the economic recovery, is really in good shape. So we're looking at an unemployment rate around 5%. So it would take, a bit, I think, to get back to that level. And so we're asking for that support to continue for a longer period of time to ensure that we can continue to provide health services to people.
And also, one of our consultants, Rachel Cahill, since you were talking about extensions, Tara, in terms of SNAP, emergency allotments have now been extended through May. And we also know recertifications have been postponed for June in addition to March, April, and May. So that's something that we're trying to stay on top of at Community Solutions. We do have some more questions. If you have any other questions that pop up, feel free to type them in the question and answer box or in the chat box. This question is kind of just an opinion question for the panel. What role do you think 24/7 news coverage, this person is specifically concerned about seniors constantly watching, might play into the fear of older adults?
Yeah, probably does. I mean, this is all the headlines are about a dangerous virus. One thing I would say, though, is that I don't know that those fears are misplaced. So, when something hits the news, we always start to hear about it, and especially from older adults, because we know from lots of other data sources that older adults do pay a lot of attention to news sources. And to traditional news sources. We've heard that in some of our other research that we've done. So yeah, I mean, I'm sure that is contributing to some fear, but again, I'm not sure that it's misplaced fear.
Great. Another question that we have, someone's saying that the stay-at-home order maybe isn't the issue to worry, but cutting of the state budgets on vital services will be concerning. They're asking if there's anything that they can do or anything that Community Solutions plans to do in terms of combating those cuts. And I know there's been some advocacy for sure on our part so far.
Yeah, I think that's a Kelsey and Tara question.
Yeah, I don't know, Kelsey, if you kind of have the broader look at the AOF membership. I think that we just talked about this yesterday.
Yes, absolutely. So this is something that we are talking amongst ourselves at Advocates for Ohio's Future. Again, our membership includes a really wide range of health and human service providers and policy folks, from housing to behavioral health to food insecurity, healthcare access, and the like. So really our next step is where do we go from here? We understand that the first round of cuts really only cover, again, the next 2 months, or really the last 2 months of the fiscal year that we're in. July 1 starts a new conversation. Really our job as advocates in health and human services is to make sure that we maintain the services and eligibility that were available before this public health crisis, and make sure, again, we just need to maintain the services, especially during this time. There's never been a more important time for safety net services and to make sure people can take care of themselves. So this is where we are beginning to formulate our strategy moving forward. We know that things are going to look different. We know that we're going to have some really tough conversations with legislators. It is their job to balance the budget. They can't close the books on the fiscal year until they do that. So we are kind of gearing up for those discussions and still developing the strategy on our end. Tara, please add anything that you think,
Yeah, and I think just to touch on what can you do, those of you on the call, if you're not already, I'd be pulling together that information to really highlight why this support is so critical. So, showing what you've done to adapt and make sure people are receiving services really, stressing, especially anyone who may have received increased support in the state budget recently. Those are often, unfortunately, quick targets for reductions. And I think being able to show, what services and how critical all the work that all of you are doing around the state, to be able to share that with your legislators. And, this is also, we're heading into the summer where folks from the General Assembly will be at home. So, on-site visits might not be a thing this year, but as much as you can be creative and really connecting with the legislators who directly represent you and the clients that you serve in your communities, and make sure that, they know how critical the services that you provide are in the community. We're approaching that time of year where it's a good time to connect with them back in the district. So just a good reminder of keeping those lines of communication open with your legislators.
Great. This question, Emily, I think it would probably be for you. Are we planning on doing another survey at the end of the summer to possibly compare the different survey results?
We are planning to do additional surveys. I'm not sure exactly when they will be, but part of the reason that we wanted to do this and wanted to do it right now was so that we had almost a baseline for what people were thinking and how they were responding right when we were in the middle of it, so that as things start to move forward, as those conversations about funding cuts at the state level start to happen, as we start to know how things are going back, we'll be able to have a sense of what that change has been. So yeah, we are absolutely intending to continue to do some surveying over the course of the next several months.
And I'm sure we will announce that in our 5 Things You Need to Know newsletter, which comes out every Monday, and also on communitysolutions.com, which is also where this presentation will be, and the slides will be available immediately after the presentation.
Yeah, and I also just want to again thank everybody that responded to the survey, and especially those that shared it with their networks. I mean, we did get a very good spread, much better than we often do with some of the work, the survey work that we do. So thank you again.
Now, this question may be answerable by anyone. I'm going to throw it out to the group. Demand for services from agencies will increase greatly. Do we know if agencies and legislators are looking at that?
I'm sure that they are. I'm sure that they are, and I'm sure that folks have been great about beginning to share all of that with, the agencies. If especially Medicaid, is involved with paying for things, they're aware of demand. But in other spaces, I'm sure that folks are beginning to share that information with policymakers. It's definitely important to continue to share, and that's why I think having those numbers and how dollars are being used effectively and efficiently is really important to continue to share.
Great. Now, this question is probably more policy-based, although, Emily, I know you've touched on the big concern in terms of PPE, but do we know if there has been any inclusion or conversation at the state level around supporting businesses or nonprofits with providing PPE, either around affordability or accessibility?
I don't know for sure that is, I know that part of the federal dollars that are coming through the state have to be spent directly on pandemic response. So that's flowing through state and local government. So I imagine that there is some ability for some of that to be spent on PPE, but I'm not sure that anyone has developed a comprehensive plan. Actually, I'm pretty sure that no one has developed a comprehensive plan to be able to distribute that PPE across the board to everyone who will need it. And, I think we're also going to see demand from lots of industries that have never had to think about PPE ever before because of all of the reopening announcements and all of the regulations around that. So it's going to be, maybe that's another task force that needs to develop about how to navigate distributing PPE.
And I'm not sure if our survey this time touched upon this, but I'll ask the question to the group. If we have heard anything about concerns about the availability of childcare for employees. I know anecdotally we all have, but not sure if any of you would like to share any additional information with the group.
Yeah, the availability of childcare issue is not something that came up on this survey, even in the responses to the open-ended questions. I don't really know why it didn't come up. It could just be the particular questions that we asked, but I think that, again, that's something going forward that's going to be, increasingly something that we can dig into a little deeper. When we ask, this survey really asked what are you doing or what is happening? And I think we can start to ask them more, and why are you doing those things as we go forward?
And I think we heard I was going to say the governor, I think said that he was going to mention childcare plans moving forward, but you would definitely know more than me, Kelsey.
Monday,
no, you're
right?
absolutely right, Danny. The childcare announcement is coming on Monday. As far as his plan to open up, I'm sure very different. Again, just like everything from what we're used to, but again, expect some answers from the governor on Monday.
Now, Emily, I know you answered this one in the chat box, but BVU also did a survey of this type. There's an article about it in Cranes. Are you aware of it? Sounds like you definitely are. How does it compare to our survey?
Yeah, so BVU, Business Volunteers Unlimited, in Northeast Ohio has been rolling surveying nonprofit organizations. Their surveys like 10 short questions. Some of it overlaps a little bit with ours. A lot of it does not. But that was one of the things. I'll try and find a link to the results. We've been seeing them. We've been getting some results from them periodically, and they're really interesting about how nonprofits are adjusting in board involvement and some other things. So yeah, so BVU is one, the one that I mentioned previously and shared a link to. The Federal Reserve Bank of Cleveland has done a survey that I haven't seen any results out yet, but I expect to. We actually borrowed some of the language that they used for some questions to be able to overlay it. So there's a lot of information that will be out there that provides this kind of snapshot moment in time and the different things that are impacting groups.
Now, this question, I know that we will have heard about specific efforts regionally, but I'm going to pose it to the group. I'm not sure if we have an answer to if we've heard of any policy proposals to improve broadband infrastructure in rural areas, particularly in Appalachia, or improve availability of computers and subscriptions to IT services with limited incomes. I know up here in Cleveland, there were some targeted efforts specifically for CMSD, and I know the the parking lots are open in terms of Wi-Fi. Not sure if you ladies can add any additional efforts to the conversation.
I haven't heard anything. It's certainly been discussed a lot, but I haven't heard anything specifically done through legislation or any specific response from the governor's administration. But one would think that if we're working toward reopening schools in a different schedule, different process next year, that over the next several months, that's something that will be part of the discussion. I mean, I certainly know that has been a challenge for many children to continue their education throughout these last few weeks. So I think that will almost certainly have to be part of the discussion to restructure the school week or school year going into the fall.
And in terms of infrastructure, I'm not sure, but I do know the Federal Communications Commission does have a Keep Americans Connected pledge. where they're trying to get internet service providers to vow to waive late fees, to vow to not disconnect service. So there are some things being done. I guess we'll all just kind of have to wait to see if it's enough being done for that digital divide. Some of these questions I would like to know the answer to. I'm not sure if we're the experts to definitely answer. One person asked, what additional steps need to be taken by the government and nonprofit to get younger and middle-aged adults to wear masks when they're out and about? Not sure if you ladies have any thoughts on that.
I'm waiting for the Pew survey results to tell us something about demographics of mask wearing. So then maybe someone will have recommendations.
And was there anything else, Emily, just as we're wrapping up in the last 5 minutes here, in those open-ended responses, was there anything else? I know you said nothing really shocked you, but was there anything else that sort of jumped out at you in terms of concerns in the past or concerns moving forward for the organizations?
Yeah, I think overall, one of the things that really struck me, although I shouldn't have been surprised about it, was the degree to which respondents were really thinking first and foremost about their clients and the well-being of their clients and the well-being of the community. You know, it came through in almost everything. And honestly, I think that's probably why we didn't hear that much about childcare, because people who are working at these agencies are dealing with their own concerns, seeing much larger issues among those that they are seeking to serve. And so, you know, it's almost this thing where it's like, well, yeah, I have my own issues, but I'm able to deal with them. And I'm working with people that really need help much more. And so, you know, over and over again, it just emphasizes the compassion and the dedication to community that nonprofit organizations, local government agencies, those who are providing direct services across the state, I mean, that's what they're focusing on. And it's almost like, we'll figure out the rest of the stuff. Right now, we need to try and make sure that the people in our community are okay.
Great. And with that, just going to remind everyone that the slides will be available and also a recording will be available later today at commsols, commsols.com/webinars with a capital W. And with that, Tara and Kelsey, if you have any closing comments, and thank you again to everyone for joining us today.
Sure, thanks, Danny. Thank you so much to all of you for joining us this week and all the weeks you've joined us. We really appreciate your engagement. This was a great conversation. We're really happy to be able to share directly all of this information that we've collected and get questions directly from all of you. Certainly look forward to continuing this webinar series in the next few weeks. Next week, May 15th, we'll focus on racial inequities and the COVID-19 pandemic. So please visit our events page on the communitysolutions.com website to register for that event. You'll also be getting an email next week to ensure you have all the information to register. And I think with that, have a great weekend. Happy Friday. We made it another week. Thank you all. And thank you, Emily, so much for your presentation. I really appreciated getting the deep dive into the information.
Happy to be here.
Thanks, everyone.